is we talk about, when you saw your x-rays with you, these are all basic people that I've seen before, is where your spine's having problems that are not normal, right? Take your x-ray up top, your x-ray versus normal up top, normal, your x-ray here, and how it's different. Maybe your neck, low back, whatever it might be. So you understand if that's different, why is that causing your problem? What I want to go over is how the nerves that go through those bones, that go to your arms, go to your legs, go to your head, go to your fingers, you go to your organs, control how you feel, control how relaxed you can get, and more importantly, control getting strong and getting to where you tolerate more stress. Okay, everyone's stress is not going to change. Okay, I don't want to tell my patients you got to change your job, leave your family, put your dog or cat down. That's just mean. Sorry, I didn't meant to say that. But that's the thing is, how do we get changed? How do we maintain our normal lifestyle but not be affected by that? Okay, that's the plan. First part here it says, just to read it, understand chiropractic philosophy and shift the patient's perception of chiropractic care. Our biggest thing as chiropractor is, yes, to move the bones, but also get you healthier. That's why I prescribe the exercise and stretching we give you, so your body can get there and stay there. That's the plan. Okay, I want you to feel strong and relaxed all the time. I want you to feel happy. I don't want you to feel grouchy because it brings me down. You know, I can't handle the pressure. Okay, next part it says includes extending treatment beyond neck and back pain we just talked about. Here to achieve your wellness, which is what that means, of body and mind. So when you feel good physically, right, you have the endorphin release. You almost feel like a better mood, better attitude. We'll go over that in detail in the talk too. When you get to that mood, because that mood tells me your body's doing well because you're moving your body around. The movement is the key. How do you connect the dots from being in pain to relaxed and healthy and strong? Okay. First part here talks about embryology, study of the human body, how it connects together. Okay. So here with the human body, we have when it first forms, sperm and egg come together. Embryology. And when that happens, overall, what happens is the sperm and egg come together. It forms what's called a big group of cells called a mesoderm. Okay. There's no test in the language, but if you know it, then you'll know more than me when I was a kid. Okay. Once those sperm and egg come together to form this group of cells, that allows things to start developing and specializing into different things down the line, like bone or nerves or brain. Okay. By having that, the first separation after 7 days of fertilization is the primitive node and primitive streak. Ooh, first test. What do you think that is? What do you think's up here?
The nucleus.
What's inside this thing?
Your the actual nerve.
What's inside this?
Your
Brain. What's inside the skull?
brain. Okay.
The brain.
Brain,
Sorry,
yeah.
I gave it away.
Okay.
Dang it!
Yeah.
I'd be horrible on like attorney's, I guess, class or something. What connects the brain? What's the bottom part of the brain? What's that soft tissue inside the spinal column? No. What do you think? What else? What's inside the spinal column?
Nerves.
It is a nerve. It's called the spinal
Nerves.
cord. Yeah.
Yeah.
So it's a nerve for one too. That's the first thing to separate. So our body is intelligent to saying we have to make sure our control system of our body is working first. That's the point of this. We want to make sure we differentiate our body properly, step by step, so it grows into a healthy fetus and then baby over time. Okay. From here, the body will separate into nerves that go from the brain, exactly, to the spinal cord. The very top part, just to be detailed about it, spinothalamic tract to the spinal cord. The upper part, opposite side. The lower part, same side. Okay? These are red for this because these use red here. From this side, the left side, outside the body, and over here. So our body's developing over time to connect this wiring system to everything, every organ, every tissue, every soft tissue, even hard tissue in the body over time. It wants to connect to control and sensitize what's going on. We use that word sensitize more often. Okay. From there we have different things that develop, like the heart. Okay. Let's draw a couple kidneys here. Even a liver across the top. All right. Any questions of my artistic ability?
No.
I question my own artistic ability. Okay. It's not that good. Okay. But over time, we understand how things work, right? So again, here, instead of drawing arms and hands, I draw little fins like a sea turtle. All right, so we have extremities. We're a sea turtle, I think is a mammal. Like a mammal, we are mammals. We have different appendages where the nerves go out to that control that part of the body too. Okay, so these nerves travel through the whole body, controlling not just the nerves that go down the arm and hand, or causing headaches in the head, but also the organs also. That's just physiology, it's not chiropractic. It's how the body works. Okay? Any questions about my awesome drawing? Nothing yet? All right. Next thing. Here, I'm going to erase this part. What I want to go over first is the spotted part here, where it says control, but what controls the development function of the whole body. Energy electrical impulses that travel through these things, energy electrical impulses that control that, when it's done well, allows normal nerve flow and allowing a healthy body when it's normal. Okay? What happens is when these are affected, that can be an issue. So I'm going to go over what normal should be. Alright, so erase this part. Is that okay? You guys want to picture this? You guys good? Let me make sure. Alright. So here, take one of those small nerves and blow it up under a microscope or high power camera resolution. We're going to go take that nerve. We're going to have three different nerves. Okay? We'll have one nerve here, number 1, number 2, and number 3. Okay? All three nerves, same nerve, but different impulse and energy flow. So the first one, let's call it the relaxed nerve. Where's my blue one? Blue's like a relaxed color, right? Blue?
Yeah.
Okay. The relaxed nerve has a different sign. I think it's called the sign. It's not called sign, but I think it's maybe trigonometry or one of those higher math studies. Sine wave where it goes here and relaxingly and smoothly travels through a normal speed and normal amplitude, high and low. And that nerve where the nerve stays relaxed, so the body stays relaxed. This can be, say, an arm. Oh man, I'm testing my ability here. All right, or like the back of a head or something. I don't know. Right there, happy nerve. Big stuff up my head now. This is on my creative side, which is very creative. Any questions about that? The nerve flow should be max amplitude if you want to measure it, along with speed. When you do a nerve conduction velocity, you've probably done that before, it's your testing floor. Okay, that's what they want to know. Is it flowing normally at a normal speed and normal height on sine wave? The problem is when you have nerve irritation, at that point those nerves, oh man, they go crazy. They go way beyond what they can handle. Okay? And they go very quickly to the other side. That'll cause let's say a weak muscle. So like someone here, stick figure, you're just like, can't, I don't know. I'm just making stuff up. They can't really move well. Just, I don't know. That's worthless. But a sad face, or even an angry face. Okay, just like, not feeling good.
Like tennis elbow?
Exactly.
Tennis elbow?
Tennis elbow. Okay, it could be anything like that. But something like that person over time, because they're having a lot of pain, could have problems with headaches, arm pain, back pain, neck pain. They just feel like tired all the time. They have that type of face all the time. Okay? So, not good, right? Sad. Very sad. Mm-hmm. Over time, though, that can actually get worse. Not good. So here, if it gets normal, then over-exaggerated speed and also amplitude, now it goes from a very tight and sore phase to a very weak phase. All right? That's pretty bad. That's when you have someone who has from nerve pain to muscle weakness. Okay, so that person is probably either here, it's like just done with it, or like here, they're like and it's like I don't know, just like I don't know, anxious, depressed, on the verge of not making it. Okay, that can cause problems with arrhythmia in the heart, problems with your organs sometimes shutting down for one too. I had someone come in about probably 4 or 5 years ago, 24 years old, not a very older gentleman, but he had a lot of construction work and also a mechanic too, a lot of lifting stuff. Came in a lot of severe pain. His x-rays were horrible. Hey, you know what? A lot of pain. Take this to the emergency room because I think you might need surgery. So the reason I sent him there because he hadn't urinated in 3 days. Had not gone to the bath 3 days. those nerves affect the bladder when it gets that bad, your body becomes more toxic. Isn't that good? Right? I said like that's not a good sign. Get out of here. Not be a chiropractor to know that, but then once you realize that, okay, you have to make sure the right treatment the right way. The nerves being affected that way. So any questions about this? 3 phases of nerve flow. That's the key. If you get these nerves to go from here, wherever you are, back to here, you go from a sad face, angry face, or like, I'm done face, to more like, hey, I'm happy again. Have this high-pitched voice because it sounds good for me. I don't know. I do that. You know, that's what I do. Any questions about that? Nothing yet. That's basically the last part here. Talks about the subluxation, which is something we don't use very often language-wise. That's the light. That's the less than light. So this is normal light flow. This is a light that's going to basically blind you. This light that's kind of getting dimmed out. Okay, so that's when chiropractors talk about subluxation. If you hear that word, it means less than light because you're more here, because your body's kind of wearing itself out in an unhealthy state. Okay. Next one is this is the fun one. Gets me every time, tears me up. Okay. Erase my awesome drawing again. Here. So this one talks about, these go to hand in hand. The nerve chart, also the effects of nerve chart, along with this one here. I can hold it up right. Double them up. All good? Okay. So, explaining this one here, left to right is your spine. Okay, as we see. Middle part's your area or location of your body being affected, one of those. And also the symptom that you're going to feel. All right. Any questions about that? I love the class participation so far. It's awesome. Just saying. So, if we know that's how the body works, it's physiology. It's not chiropractic. It's how the body works, physiology. Let's go through that. For number 1, on your second paper, it says factors affecting your health. So when there's a subluxation or nerve being affected, for example, it can affect exercise. Okay, exercise. Number 1 needs an E at the end. Okay. So if you have an example of exercise being affected by the nerves, you go down to what's called subluxation of C6. You have this one, correct? Okay. Go down to your normal paper, your nerve chart. C6 is about 6 numbers down. Vertebrae area. Talks about neck muscles, shoulders, and tonsils being affected. One of those two. Okay. If you have that having a problem, it can cause a stiff neck, pain in the upper arm, or sometimes say shoulder too. Tonsillitis affects the actual tonsils, organs, whooping cough, and croup. You don't get whooping cough very often anymore. It can cause that symptoms of. I had someone come in here a couple months ago. She was in the Army, and she was real educated too. She had a PhD, and her voice had changed. Had gone from very hoarse to more of a smooth tone, just from that neck being under control. It can affect everyone differently. Okay, so knowing that in those areas, it can affect your exercise for 1, 2, affect your overall body from relaxing, relative to being in a stiff, tight space. Okay, injury, no injury. Wouldn't say people that have injuries from whiplash or car accidents are easier to treat because it happened 2, 3, 4 weeks ago. It didn't take 4 or 5 years for it to develop over time. All right, any questions about that? Nothing yet? Oh, good, I'll move on then. T1. Let's go down from C6 to T1, about 2 down. It says it affects the lower arms and hands, okay? Elbows, so elbow pain. Hands, wrists, and fingers, esophagus, things like that. So, beyond this nerve chart, we progress you guys to a different technology here. This is our neuropathy area, okay? So if I go down to T1, this area here, it causes what? Oh, arm pain, shoulder pain, hand pain. And when I say pain too, it could be weakness, tingling, burning, anything like that. Who come just with arm weakness or tingling down the fingers? I'm like, that's probably nerve pain. Numbness, tingling, that's nerve pain. Pain, that's neuropathy. Pain can be muscle or nerve. So you kind of got to differentiate where you are, what you're having, and what arm it is. Usually one arm is a nerve, one arm being affected at a time, causing those issues to happen. So our job is, how do we know where you having problem location, and from there figure out which nerve is being affected, get that spinal bone to move to allow that to get better. All right. Any questions how the sequence works? Nothing yet?
I'm just wondering, you know,
Yes.
how I said about tennis elbow?
Yes.
And I had tennis elbow twice, October, and then again the next year it
Mhm.
happened again. And it was on this arm. And it's funny because now that I had the car accident, it's like this side is affected. I don't know if you had said it was because of the seatbelt, but it's funny that it's this side
And that's-
again. I wonder.
That's the trauma side now because of the accident.
Mm-hmm.
So that probably is still there, an issue.
Mm-hmm.
We're going to run down from the neck down the arm. But realize once you take care of one thing, we're taking care of everything at the same time. See, most doctors will focus on that one bone here,
Yeah.
or that one bone there, and maybe just one side. We focus on the whole thing, so your whole body's being helped. That's the difference. And so when you have that, because that people come before, especially back in like the early 2000s, maybe even late 90s too, coming in with carpal tunnel, right? You ever know what carpal tunnel is? Hands go numb, fingers tingling, pain sometimes too. It's more numbness by definition. They'd have a surgery here, didn't go away. So had the surgery over here, didn't go away. Had no surgery over here. They keep going back and forth. I'm like, what the heck's going on? They never looked at that nerve in the wrist coming from the neck, causing that to happen because they have a desk job all day. They do this all day. So now they sit in the car all day maybe. So how to demonstrate a nerve issue here or here or both? It's called double crush when you have a problem here, meaning nerve being pinched in the wrist, along with neck issue. It may be symptomatic, but the problem might be here or even the elbow too. We'll look at all the areas connected to make sure you don't miss anything. That's the issue. But the problem is with old work comp injuries too, is they focus on, if you have diagnosis of the wrist, they looked at just as they were blind to everything else, that the person had actually an arm and a human body.
Mm-hmm.
That was all they look at. So now we're focusing on the whole body as a whole, how to get the whole body healthy. Just connect to the shoulder and arm, get everything in there loosened up too. Can I answer your question though? That's the goal, is how do you make,
Yeah.
as you go back, as you start with yours, for example, more stretching, more exercising, make sure this stays away. That point the whole body gets healthier and stronger. That's the plan. Okay. Let's move on to, any other questions about that, huh? Anyone else? In the audience back there, anyone? Making sure, okay. Let's go to the lower back. Let's go to L4, causing backaches and sciatica. So go to our form again, here, way down, L4, like I think 3 or 4 from the bottom. The effects, the areas, the location effects is the prostate gland, muscle of the lower back, sciatic nerve pain. Any questions about that? Okay. What is sciatic nerve pain? What is sciatic nerve? Anybody?
What's that?
Sciatic nerve pain?
Oh,
I think that is.
it's that pain that you can't really pinpoint where it's happening. It goes from the bottom all the way to your buttocks.
That's exactly where it can affect all those areas in the leg, where all these nerves come out of the spine. The last 4 or 5, they form one trunk and branch off down the leg, from the hip to the groin to the lower leg to the knee to the calf to the foot to the toes. Present any way it can present, but it comes from all those nerves forming one trunk, and then branching off again down the leg. Does that make sense? See my imaging? Anyone?
Yeah.
Anybody? See that? Got it? Good?
Got it.
I'll work on that later. Okay. I used to be a hand model, I think, in my past life.
So are you saying that chiropractic can help that? If somebody has
That's
that?
what we do. We do is if someone has those symptoms, someone has an x-ray that demonstrates abnormality in the lower back, that we can open up those areas, make it look like a better x-ray, better normal, then we fix that area. I want to say about 12, 13 post and pre and post x-rays of someone's lower back showing the improvement as videos on our website, on our YouTube, on our Instabook and Instagram, whatever it's called. Okay. So what we do is cause the motion to occur, so we cause the spine to change. That's when the nerves work better. They go back from a relaxed state versus an excited state. So we focus on.
What about when you have like arthritis, like
Good.
I do?
If you have arthritis, our job is to cause as much motion as we can.
Uh-huh. That
That stops the arthritis. Arthritis, the ligaments around, say for example, the joint, the left and right side of the joint, because there's no motion, want to calcify. In the spine, same thing. If there's no motion, the ligaments in the very front or the back want to calcify. We'll see that as arthritis on the actual x-ray. If there's still a disc between the bones still left, you can cause the motion to occur. The disc will improve in height. That disc height and the back of the spine will stay open, allow it not to progress even further. So we take an x-ray, for example, someone like that, maybe once a year, once every 2 years. you see that arthritis staying versus being told for the medical doctor, once you have it, it's going to continue to get worse and worse. You need surgery. You're going to die. We're all going to die eventually. You know, like, give me some good news, doc.
Yeah.
At that point, how do we progress from getting worse? By causing more spinal motion first. And you maintain the motion so your body stays back, so that curve of the spine keeps the bones open. That's the plan. How do we get that curve back to better normal? Keep that space open, so you keep that motion going the whole time. By improving your posture, maintain that better posture, which we're all working on right now, right? At that point, exactly, I saw sitting up there like, okay, I'm good, yes, I'm good. But how do you maintain that over time so we don't go back here again where it locks up again? We just didn't know before that this was good for you. So now that we know, let's maintain that better position. All right? My soapbox for that part of my story. Any questions yet on the exercise? Let's move on. Let's get to the Dodger game, I think, or something. I don't know. So here, exercise is covered, right? We're going to exercise.
Yes.
Next one is going to be diet. Can chiropractors help diet? Maybe. Okay. Can it help diet, or more importantly, the organs that control your ability to digest food and break down food over time? So we talked about subluxation at T6. Go down to your form again. Controls your stomach. Hey, that's magical. Okay, controls your stomach. Causes stomach problems, including nervous stomach, indigestion, heartburn, dyspepsia. You know what dyspepsia is?
No.
I don't know either. I keep something to look it up, but I never look it up. Eventually I'll look it up. And it's something probably like Pepsi? I don't know. I have no idea. I have to mix up my head again. No clue. Okay. But if you have someone coming here with stomach pain after they ate a lot of food, gallbladder issues too, it's all connected to your stomach. So they came in going on a Monday, hey doc, I can't see on Wednesday, I'm having gallbladder surgery. I'm like, what do you mean gallbladder surgery? They're taking it out. Why taking your gallbladder out? Because it hurts all the time I eat. Go. That ambulance pass, care for the person. At that point, I'm going to, what in your diet is causing issue? Well, they said it's maybe not diet issue, maybe not diet issue, but let's just take it out because it's not really a necessary organ. Come on, people. Gallbladder for a reason. Emulsifies fat in your foods. That allows your body to digest the food properly, get out of your system overall. So what I did is had him change his diet a little bit here and there, just normal stuff. At that point, he kept his gallbladder. So be like, when you lose your gallbladder, you eat fatty foods, you have to go to the bathroom right away. So knowing that your organs are important to have in your body, not to take them out all the time, tells me by having a healthy spine, your organs function normally. Okay. When you're under stress, is it easier or harder to lose weight? Harder. Everyone knows that. Because your body doesn't want to digest the food properly. Your body's actually meant to store food more as a protective mechanism for whatever. So keeping your body in a relaxed state, your stomach, for example, in this situation, keeps your body overall healthy from a nutrition perspective. I won't say diet, but more nutrition perspective. Okay. Let's move on to the next one.
I have a question.
Yes, ma'am.
On T9,
T9, yes.
the allergies and hives, have you actually had a patient that you were able to stop their allergies and hives to?
I have Adam right now. He's a high school kid from Claremont High School. He's a sophomore. And he's had a problem with allergies and headaches combined with that for probably about 3 years. 3 years. He's been in the office for about probably 2 months now. Headaches are gone, allergies are gone. If the body's under stress, do you know allergies come from what's called histamines? Okay? It's in our environment all the time. We have it everywhere. If our body is under stress, like his was, he does a lot of bike riding, he does a lot of skating too, stuff. I said, don't tell your mom, but I know you had a bad accident here and there. Okay? So for his body is stuck all the time. He's had trauma in his body. So his body, to tolerate that stress from histamine environment, is not existent. So if your organs in your sensory organs in your nasal cavity, along with your throat, are sensitive because they're not working as well, he's going to have the allergies. Some people have real allergies, but his was more external trauma-based versus actually internal problems. So, and go to your questions too with allergies, other issues too, considered, if you want to call it not medical conditions, but people deal with all the time, even migraine headaches. People sometimes run right to the doctors. We're told to take the antihistamine, take the anti-migraine medications, take your sleep medication. The problem is you're not dealing with the underlying cause. Our job here is to look at the underlying cause first, and which is about 95% of the problem, 95% of the problem, 95% of the problem, versus 5% is more hereditary condition you're born with, or something that you get over time, like type 1 diabetes. So can we look at things more naturally first and focus on diet, nutrition, moving, things to de-stress your body first, and then see your doctor or go to medication second. So right now in our world, it's more reversed. That's why my patients sometimes come to me going, I've been on medication for 10 years for this, hasn't helped me, what do I do now? You're coming here going against a medical doctor's recommendation versus listening to them over and over and over again. So my job here is get them sometimes off medication by getting there, looking at the root cause of the problem versus what's been dealing with the symptom the whole time. Okay, kind of answer your question in a long format. That's the long way. I have a shortcut, but I don't know what the shortcut is.
So like,
Yes.
to me you showed me this is a good spine, this is a bad spine.
Normal out.
So would it be like the same thing, they're too close together, just lower?
Too close together, or it could be where the spine, like this, T9 is about the mid-back area,
Yeah.
where your body's doing more of this,
Mm-hmm.
locking in this way. Where instead of being straight, it's more too hunched forward. So that abnormality makes things want to lock itself up. We're not too close together, sometimes not too close together, but it can be locking up because of that position. There. See, the ribs allow your body to normally stay open because they allow things not to move too much anyways. But when you have that forward position, it can affect your breathing, can affect your heart, can affect a lot of stuff. Okay, so T9 is about here. For example, they're actually, let's go here. Here it is. So actually T9 does affect your heart. There. Okay, even I think your lungs too. Yeah. People come in here sometimes. I have 2 patients this year come in with arrhythmia, heart palpitations. I said, well, what did your cardiologist say? It's not my heart. I'm like, good, perfect. Heart's fine. So theirs coming from stress because those nerves go back to the brain from your spine and make your body stay under stress. Cause shortness of breath along with heart palpitations. So when you go to urgent care with those 2 problems, what do they normally do? Give you medications. Or tell you have anxiety. Here's anxiety. That's what people do. Here's anxiety medication. Because you have shortness of breath and you can't breathe. You feel your heart's pumping out of your chest. Even though they're not a psychiatrist, they go, here's heart medication and anti-anxiety medications. If that calms down temporarily, comes back in. Come in here after sometimes months and years of dealing with it, work you differently. I had a patient, Rachel. No, it was Rachel, someone else. Forget her name. Used to drive to Commerce every day for work from Rancho Cucamonga. Every day. Came in, about to quit her job. She had arrhythmia. Heart was just pounding her chest every day. Hadn't slept very well. Doctor said, well, you got to quit your job because it's too stressful for you. Okay, that word stress. Okay. I said, well, again, cardiologist said you're negative. Heart's fine. So I said, let's treat you because she had a bad neck. Body had changed because of her posture because she's driving to City Commerce every day. Got from here, good, happy, to like, ugh, just toast. Okay, so working on her every day, about 3-4 days a week. She went from sleeping a little bit better. Went to actually walking a little bit more. Okay, walking maybe 10 minutes at work. Sitting up better at work too. Came home from work, walking, coming home. So this went away. Her breathing got better. She went from being a quiet, just kind of a grouchy person to more like, hey, what's going on? I'm like, oh, chatterbox now. Dang, stop talking so much. That thing is, that personality changed because her body was less stressed. That stress didn't change. She drove the same route every day, to the same traffic, same people at work every day, but she was able to tolerate that stress better. One thing moving that caused the nerves to calm down. Secondly, allowing her body to de-stress while she's at work by walking, coming home de-stressing by walking again. Does that make sense? So we have problems sometimes you deal with medications and neurosurgeries that can, if we look for the underlying cause, we can treat on our own by de-stressing our body on our own. All right. We'll talk more about that de-stressing in a minute. That's answer your question, you in the back with the Bob Marley hat on? Good. Okay. That's the thing is everything here is connected to your body in human physiology. How do we control that? How we can do on our own and then seek medical attention? Because medical attention will lead to more medications and or surgeries. We want to avoid that if possible. Next one is attitude, PMA. What do you think PMA stands for? PMA.
Posture.
Almost. What do you think? Let's see, Thrive on the shirt. Thrive?
That?
Let's see.
Their shirt that says Thrive.
Safe, right?
Uh-huh.
Cool. Okay. Good, good. What do you think this means?
You got me.
It's, if we talk about mood, right? What's the other word for mood? Starts with an A.
This is our quiz, huh?
Is that the only one who had coffee
This is
tonight?
our quiz.
Is that the only one who had coffee 10 minutes ago? What's going on here?
Yeah.
I caught
Probably.
you morning.
Coffee all day long. Attitude.
Oh.
So what's PMA stand for?
Positive.
Yes.
Mental.
Yes.
Attitude.
Positive mental attitude.
Okay.
If and when we have that, are we motivated to exercise more, eat better, just be nicer people sometimes?
Yes.
Okay. Then can that be affected by your nerves? Yes. Okay.
Mm-hmm.
That area there talks about C1. This is the big one. Okay, C1. Pay attention, people, for this one. Okay. It talks about your nervous system. What I mean by that, sympathetic means one thing. Sympathetic. Not pathetic. That's the other one. Okay? That's your stress. I'm going to put that in red, I think. I'll put it in red. More exaggerated stress. I know, it's painful. All this knowledge. All this knowledge late at night is tough.
We'll go, Bertie. Sorry.
That's what you do. I get about 5 in the morning to go to the gym, but I have coffee all day, so I'm still alive. That's your stress response in your body. Okay? Here, going back to this chart, here, okay, autonomic nervous system. Autonomic means automatic. Talked about the lungs and the heart earlier. They work automatically. I don't think about, okay, beat faster, beat less. It happens automatically. All these organs in your body happen automatically for the most part. Okay? What happens is, when your body's under stress, all the nerves will fire to make your body stay under stress. So if a nerve from your spinal cord fires for a while, causing, for example, leg pain, right? Okay? Or arm pain, or headaches, or neck pain. That's easier for a while. Our body sends the nerves to the brain, and then the whole body goes, you know, we're still here in this state. Let's stay here in the stress state. Whole body fires, so your body stays in the stress state. That's how you get a back pain causing heart rate issues or breathing issues beyond the nerve pain. So when I interview you as a patient, I'm not telling you this because it's more subliminal, if you want to call it that, or what I'm looking for when I talk to you. When I ask you how you're sleeping, it's not because I want to know, yeah, you're using a good pill or not, or sleeping less or more. If you're sleeping less, I'm looking at, okay, if you're that's a sign of a stress state. And my body's not working fine. My brain can't turn off when I sleep. I stay in alpha, if you want to call it sensitive sleep, where I can hear a car 3 miles away and it wakes me up, versus deep delta REM sleep where I recharge. My question is, do you sleep well? And if you say no, do you wake up where you're recharged? You say no, I'm like, great, you're in a stress state. It's my first sign.
You can never go into REM.
That's the tough part. It's tough for people. You know, what I look for is, if you're here, what else is it affecting, or is it affected by your body? So you may come in with neck and back pain. That's my carrot. Neck pain. Yes, I got you. But can we get to other things in your body that can get healthier over time? So when you sleep, you recharge, then you have a better attitude. You can do more things throughout the day without all the coffee I drink.
Okay, we need an appointment.
Yes, I got someone in the chiropractic care. Okay, so if we're here, and when we're here, I always recommend so far, right? I want you to exercise, I want you to stretch, I want you to move things around. The movement changes your state. So when I go from here and I move, I'm just making stuff in my head. So I'm doing a jumping jack, right? Okay, and they're happy because then for a while they're like, hey, I'm happy. At that point, you go from a stress state to a relaxed state. Over time, that gets these hormones to fire instead, called parasympathetic. Again, not terminology is needed, but that's the opposite of the nerves that causes stress state. These nerves, oh man, we're out of room here. Good, there we go. These nerves affect your hormones to function properly or improperly. Not probably, but causes the hormones to stay balanced or imbalanced. Okay? These hormones here that are affected by the sympathetic system is going to be your cortisol catecholamines. Those are your pain receptors. Those cause and stimulate more pain. Let you know what's going on. Here is more of your cortisol, your serotonin endorphins. So when you move long enough, you start feeling better, like, that workout made me feel good. I want you to get to this state here, where that workout motivates you to produce those endorphins, to get to the better balance. And that stress state goes to more of a relaxed state all the time in your body. That's the plan. Can you control your hormones? Yes. Control your state? Yes. We have to free up the nerves that cause it to happen and keep you moving, so once you get to a relaxed state, you can stay there. Some people that work it all the time, they're healthy, but they're here because their bones aren't moving properly. The lack of bone motion is keeping that body in a sympathetic state or stress state. Our job is to get them to a relaxed state by cause the bones to move. Any questions about that? That's my big picture. I want you moving more to keep your body in a relaxed state so that whatever stress you're under, you move more to get yourself out of that stress state. Any questions? Nothing. The stress state is we're all going to be under a stress. How our body's affected by that. Okay, so change your state by causing your body to move more. Or I did one interview for our podcast. She works for Music Tree. She owns Music Tree in Pomona, where kids go there to relax by playing music. Even adults too. That's how they relax. The same thing. Like working out, that may help you relax by causing motion by playing music. Or breakdancing. I know Deanna's a big grace back there. I've seen her some videos of it. I don't know. Okay. So how do we get there? We move more. We get our body to relax more. Then we keep that balanced state. It's hard to get to a stress state. We tolerate more stress this way. Okay? Next couple, and we'll be good, is going to be your, that's right, H.N.S. Ooh, another brain teaser.
What is that? Another quiz.
H.N.S. Oh,
That's the
man.
last quiz.
Last one, my head hurts.
Last quiz.
H.N.S. What is that?
Hints. Hints. We need
Hints.
hints. We need hints.
Healthy nervous system.
Oh, someone did their homework. Good. Healthy nervous system. Good. If we have that, then our body can stay in a relaxed state. And then we can tolerate more stress and not be affected by that. Okay? So this first part up here, very top, says the nervous system on your nerve chart. Says the nervous system controls and coordinates all organs and structures of the human body. That's from Gray's Anatomy. That's the Bible for anyone who studies physiology. So what we want to do is understand if that controls that, and the human body is controlled by that, then keep your body relaxed, affect your whole body, not just your muscles, but also your organs, but keeping your bones moving, keeping your joints moving so nerves stay relaxed. That's the connection. Your nerve flow controls everything in the body to function in a relaxed state or a healthy state, a healthy relaxed state or a stress state. By causing joint motion, keeping your nerves healthy, your body stays in that relaxed state. Then you get stronger over time, tolerate more stress and more stress and more stress. There's a limit, obviously. Can we do more for ourselves, keep our body healthy so when we wake up the next day, we're recharged, we're ready to go every day. Even on Sunday, even on the Sabbath. All right. It's my busiest day sometimes. I'm like, hey, a lot done. Any questions? So again, you're here for neck pain, back pain. That's my carrot I got you in the door. But can we get your overall body healthier, maintain on your own once I stop seeing you, which will happen sometime next 10 years. At that point, you keep this going by keeping your body moving and healthy and strong and relaxed. That's why I give you the exercise to do to stretch and strengthen over time so your body can stay that way. So when you're healthy, I may see you 3-4 times a year because something went out, or you went on a long trip, or you, like Dan, went breakdancing too long overnight, 2-day thing or something. All right. Any questions? That's my show for today.
Thank you.
All right. I like the golf clap. That's all it is, though. How do we get healthy, stay there, and then maintain the same habits that got us there?